And here we move on to our next victim. Now when we look at this victim right here, we notice that she's got a knife wound in her leg, probably impaled to her big bone, the femur. And slashes, we see a lot of bleeding. And stabs, we see internal organ injuries right here. So with Lori here, she's got this stab wound and it's stuck into her leg. Lucky for her, it went into her large bone, the femur, because it probably prevented the suspect from continuing or repeating the stabs there. Statistically, people that have been stabbed or slashed don't even see their assailant until they've been stabbed or slashed several times. So Lori looks like she's fared through this pretty well. So anyway, let's approach Lori here. And again, we're going to make sure the scene is safe. I want to introduce myself, make sure she knows who I am, and I'm here to help her. She's probably not going to be sitting here calm like this, especially when somebody is looking down at a big knife stuck in their leg there. Again, you want to refrain from letting people know how bad it is. I don't see arterial bleeding, I don't see capillary bleeding, I don't see venous bleeding. It looks like the bleeding is actually stopped, probably by the knife itself. So what I want to do with Lori immediately, so she's not staring at this, is I'm going to bring her down in this shock position here. So I'm going to lay her all the way down. And again, as I lay her down, I'm going to look from head to toe and make sure that I address the most serious injury first and then go on and do the head to toe assessment. I bet you can imagine that this is the most serious injury right here. The rule is that if somebody has a stab, anything that's impaled, it could be a stick, it could be a knife, it could be a rake. If it's impaled, you don't remove it. There is an exception to the rule, however. One gentleman had fallen on a big stick and it actually went through his trachea and he couldn't breathe. So you've got to ask yourself, can I pull this out? You have to, because he couldn't breathe. There was a higher priority. This is called a critical thinking skill. I'm going to immobilize this in position that I find it, because anytime I move it, it's going to make the whole situation worse. So what I want to do is get as much padding as possible. Now you're not always going to have padding to use, so you can use shirts, you can use jackets, you can use anything. You can use sticks, whatever it takes to immobilize this in here. Put 4x4s on both sides here. And then I'm going to reach in, if you have some roller gauze, or you could even use those cravats, those will work well. I'm going to roll around and I'm going to try to immobilize this in as best as I can, not moving that knife. Anytime that moves, we have the probability of lacerating an artery, a vessel, causing more damage to the bones. You want to be very careful about this. When Lori says, well, my leg hurts, I know that's her chief complaint. I've already taken care of that. Now does anything else hurt? So you can get a lot of information from the actual victim. If Lori wasn't able to talk to me, then I can always ask people that were at the scene. It's very, very important that when you get to the scene and there's other people, spectators, that you find out from their accounts what they saw as well. That could help you treat this victim as well as help with the crime scene. Another problem that we see with stab wounds to the upper chest is she's got her thoracic cavity up here, her lungs, and her abdominal cavity. What happens is she's got a big muscle here called a diaphragm, and it moves up and down. And what can happen is usually that diaphragm seals off her thoracic cavity or her lungs from her abdominal cavity, her stomach, pancreas, liver, large and small intestines. When people get stabbed in this area right here, depending on where the diaphragm is, the knife can actually go through and cause airway emergencies, like we saw with Chad with a tension pneumothorax, or it can even cause abdominal injuries or a combination of both. So again, when you look at, if say there was a stab wound right here, you have to look at the knife. How long is that knife, and where in the radius circumference here could that blade have gone? How do you treat that? Well, if she popped the lung, again, there's something called a tension pneumothorax. If there's a hole there and you can provide an occlusive bandage, you can do it. If there's abdominal injuries, there's not a lot you can do. In my business, that's called load and go, where I suspect that abdominal injury has been cut, lacerated, shared. The only thing I can do is get this victim to the hospital as soon as possible.